Everyone. Thanks for joining us. Please make sure to just put yourselves on mute as we begin. And as we start the presentation, I'm going to drop in a fun chat to get us started, a little poll. Our poll question is, did you eat breakfast this morning? This is great information. Keep it coming. And we're going to wait just a minute or two to get started for everyone to kind of join in. All right, it's looking pretty strong. Good responses. So I wanted to drop in the chat one of our favorite recipes here at Genev. They're called superhero muffins. It's a really great way for you to prep your breakfast and have really delicious, powerful breakfast just ready to go so that you can just grab it right before your meeting. So I highly recommend taking a look. It's one of our favorites. We use them all the time. So thanks everyone for joining today. I really appreciate you taking the time to join us for this Menopause 101. My name is Devin McGill. I'm the Director of Partnerships at Genev, and I'm joined today by Stacy Kasenchuk. She's our Genev's Director of Health Coaching. Genev's mission is to close the massive gap in menopause knowledge and care so people can take control of our health. Our goal with today's session is for you to walk away with more knowledge about menopause so that you can support yourself, your partner, your friends, and your teammates through the menopause journey. As an elder millennial myself, turning 40 next year, I love this session because I now have an understanding of the signs and symptoms of perimenopause. And instead of dismissing them as just a part of getting older, I can turn to experts who can help me get the care I need so I don't have to suffer through the menopause transition. So a few housekeeping items. Please remain on mute during the session unless you have a question. Definitely feel free to pop off mute if you want to ask a question. We'll also respond to questions in the chat throughout the presentation. So please drop those in and we'll save time for Q&A at the end. So today, our agenda will cover quite a few items. So I'll go ahead and start sharing the presentation. So today, our agenda will talk through what menopause is, the symptoms you can expect from menopause, how Genev treats it, RDN coverage in depth, and next steps for you. So I'd like to introduce you to Stacy. As you probably saw from her bio, Stacy is a registered dietitian nutritionist and an exercise physiologist. She leads our team of RDNs here at Genev and is an expert in menopausal transition. Stacy, I'll hand it over to you.
Thank you, Devin, and thank you all for joining. Wednesday morning, probably some of you, it's afternoon in December. I know this is a busy time, so great to see the attendance that we have today. As Devin mentioned, our mission here at Genev is really to close that knowledge gap and to empower you to not only survive, but thrive during your menopause journey. So on this slide, to get us started, this gives some details. I understand that there's a lot here, but I'm going to pull out some highlights for you in terms of understanding the menopausal transition. Most individuals going through this time do not understand that, and that's part of the challenge when they're faced with the changes that they're happening to their body. One thing to note, fun fact for all of you as you're heading into maybe some holiday parties, you can bring this up in conversation, that menopause is one day and it is represented at once you've had 12 consecutive months without a menstrual cycle. We typically hear menopause being used generally referring to the entire transition, but in fact, it's actually just that one day in time when you have that 1 year anniversary. However, the years leading up to this point, known as perimenopause, often are the most challenging for the patients that we work with and individuals going through this time. This could be changes in monthly cycles. We hear about hot flashes, but I'll talk about how that's really not always the most common symptom we see. And this part is that fluctuation of hormones that are starting to happen right before that menopause day occurs. Now, when we look at the research, this transition typically happens between 40 and 45 and 50. However, that does not mean it can't happen earlier. Sometimes for some individuals it does. For some individuals it may be later, but on average it's within that time frame. For some, it may last about 7 years. That's the entire transition. But for others, it can be 14, 15 years of a lot of hormonal fluctuations. A lot of factors that contributing to this: race, ethnicity, lifestyle factors, genetics. And so it really can be a different and unique experience for everyone. The common part that's happening here is that very important hormones, estrogen and progesterone, are decreasing during this time. And that's part of what is generating the symptoms that we see. Every individual going through this time does experience things, can experience things slightly different. If you have started into this menopause transition, you may recognize that what you're experiencing is different than your sister or your colleague or your best friends. And that's very common. Doesn't mean that anything's wrong. It just means that that's how your body's responding to the change that's happening. One of the things that we see as a great challenge for our patients is the changes in body weight, shape, and size. And this is influenced by the hormones, and we'll talk about different things that can be helpful for this. The other part that we want to be aware of are the long-term health changes to our bone, heart health, different things that with that changes in hormones that are important to keep in mind and implement strategies that are effective for enhancing and improving your long-term health. Next slide, Devin. Oop, back up one. Okay, never mind. You're good. Yep, here we are. So here are the phases that we see. As I mentioned, that perimenopause phase tends to be the most tumultuous. This is a time where not only are those estrogen and progesterone hormones decreasing, but they also can sometimes fluctuate. And so literally that feeling of, feeling fine one day to not feeling fine the next is a reflection of those changes in hormones. This is where we see weight gain, anxiety, sleep issues, night sweats, incontinence even at this time. And again, we're seeing this typically 40 to 50. I would say, late, oftentimes I'll hear patients that once they're in the thick of this, they actually reflect back and they'll say, you know what, this started in my late 30s, but I didn't really know what was happening at that time. So to Devin's point around, and I'm with Devin on turning 40 next month actually, and really starting to recognize where some of these things can start early on, but you don't recognize it because it's less frequent. But in that 40 to 50 range, these things become more frequent and often impacting quality of life. Menopause, as we mentioned, at one day in time, we start to see some of more vaginal issues, lack of libido, brain fog is certainly a concern. We're thinking about women in the workplace. And the average age is 51, but again, this is an average. We see variations here. Now, postmenopause is that phase when the estrogen and progesterone have now reached their new lower levels near near zero. It's not to be clinically accurate. It's never going to be exactly zero, but it's much lower than premenopause and perimenopause. And that's where we really want to be thinking about long-term health and the impact of this lower state of this lower hormonal state and what that does to cardiovascular health, metabolic health, osteoporosis, and so forth. So here are a number of symptoms, not exhaustive. You might hear similar numbers. I think I've heard that the research captures 30 to 40 different symptoms. However, I would say in the work that my team and I do with these patients is that there potentially may be more of that, right? We're still learning the impacts here, and every individual is unique. But here are some of the most common ones that we see as we're working with our patients. So hot flashes is not the only one. Our top, we see weight changes, decrease in libido, and mood and sleep changes are actually more common than we see individuals reporting hot flashes. So a lot of different things that are happening as an impact of the change in these hormones. So I promise we'll get to some good news here, but just to set up the reality of the situation and where Genev has come to fill this gap, is that unfortunately we see that less than 1 in 5 women seek care, and part of this is due to the lack of menopause trained doctors. And this is an unfortunate reality. Even our chief medical officer, Dr. Rebecca Dunsmore Sue, does talk about. I see the expressions in there. I know, sorry. The fact that even when she went through medical school and residency, she maybe got a couple hours of menopause training during that time. So much is focused on the obstetrics side of things, which absolutely is important, but doesn't really help when you are in that post reproductive phase of life. And so all of our physicians have specifically taken on specific training in menopause and practice in menopause. So they have that advanced knowledge and that understanding of this transition to be able to best support you. So I would like to give you just a little bit of a snapshot of what a Genev patient journey looks like and how we use our integrated care model, collaborating with our dietitian team collaborates with our physician team to provide the best level of care. So here's an example. Someone we'll call her Allison. She struggles with weight gain, hot flashes, and anxiety. So she comes in and initially has an appointment with one of our gynecologists, and that's the pathway we recommend, that you meet with one of our gynecologists first, learn about all of the options that you have available to you based off of your health history, based off of your symptoms, and your goals for how you want to feel coming through with the treatment plan. And then they can refer you to one of our registered dietitians. And you'll see here in this next bubble, the layers there indicate that we typically recommend that you meet with someone on our dietitian team about every 2 to 3 weeks for at least 3 months. Reason being, we're going to dive in and tackle things like weight management, if that's a priority for you, sleep strategies, exercise, and we're going to use a health coaching approach. We're all trained in health coaching and behavior change science, and we have the expertise as registered dietitians to be able to bring that lifestyle lens, assess what you're doing, and help you find out what things you may be doing that are awesome and supporting you, and areas where you can fine tune, tweak, or change to really support the physiological changes that are happening during this transition. A lot of this information isn't made known to individuals going through this transition. So it can take some learning and some time to implement, and we want to make sure you're supported during that. We offer text communication between our calls, and it lines up nicely. Typically, the follow-up appointment with your doctor will be in about a 3-month time frame on that second appointment. And so those dietitian appointments are really that connective tissue between then. We can also be in communication with your doctor if you have other questions or things come up. We really want to make sure you get the support you deserve during this time. There's no reason to suffer alone, and you deserve that. In certain situations, sometimes a behavioral health or mental health referral is necessary or recommended. We can provide that. We partner with a company called LifeStance, and they have psychologists, therapists, and psychiatrists all over the country. They do accept a broad range of insurance plans, and we're able to do that through our system, and then they reach out to you to schedule that. Like I mentioned, the second appointment with one of our physicians is typically in the 3 to 4 month range. During this time, we're going to follow up, see how things are working, if they prescribed a prescription medication, which could be anything from hormone therapy to a variety of other medications that depending on what you're looking for. And at that time, they'll decide what the appropriate follow up is. Typically, you're going to be looking at 6 months to a year, depending on how you're feeling, but you can always come back if things change, which is common during this time when these hormones are fluctuating. And then if needed, obviously there are some limitations to telehealth. Menopause symptoms in general can be treated really well with telehealth appointments. However, there are some times where a physical exam is needed. And in that case, we will refer to an in-person gynecologist. If you have an in-person gynecologist, we can make sure that our physicians communicate, share their notes with them, or can make sure that you have those notes to bring to that doctor. We're happy to collaborate in that way. If you don't have an in-person gynecologist, we're also happy to help within our network of connections to find someone for you.
Just 1 second, Stacy. I'm going to
Okay.
stop sharing and reshare. Go ahead.
All right, excellent. All right, this is where we get to talk about the great things, the exciting things that we can support you with. So, Devin asked a great question at the beginning of the call, and I was excited as a registered dietitian to see that nearly 3/4 of you ate breakfast this morning. I love seeing that. When we look at benefits for the menopausal transition, having a breakfast with fiber and protein is something that we do recommend because of the support it can provide with those fluctuating hormones. And this is something, what we do as we dive in deep. I always tell individuals that may have worked with a dietitian in the past or may have heard what dietitians do. And I always say we're more than meal plans and counting calories. Certainly, if you find that that's something that's supported for you, we can work it into your plan. But we really find that what it takes is really looking at where you are currently, what questions you have, and helping you understand where nutrition, exercise, stress management, sleep support can fit in to support the changing physiology that you have during the perimenopausal transition in a way that is, again, coming back to helping you thrive, not just survive. So we provide in these situations, we provide meal and snack and recipe recommendations. That superhero muffin recipe is a favorite that we do send. A really great recipe that's easy to prepare, keep on hand, and does have that protein and fiber component we talk a lot about. We also can look at specific physical activity guidelines. One thing that we often hear with our patients is, I am doing everything that I've always done before and it's not working anymore. And part of that is because your physiology is different and it does require a different approach. And so there's different nutrition strategies, there's different physical activity guidelines from everything on cardiovascular exercise, resistance training, flexibility, mobility that can all be tweaked. Doesn't mean you have to have an overhaul. We certainly want to meet you where you are and make this realistic and sustainable, but we can help you understand where that falls. Sleep support is an important piece. Often, this is an area where we definitely collaborate with our team of physicians. We see that hormone support can really be helpful at this time around sleep, but not everybody needs the hormone support. Sometimes it's a matter of doing an audit of your sleep habits and sleep hygiene and give you some suggestions there. Supplementation audit is a really big one for us. You may all, you probably get pop-up ads all the time. If you've Googled anything menopause, be prepared that you're now going to be inundated with ads for quick fixes and supplements to solve everything with related to menopause. It's kind of the wild, wild west when it comes to supplements, and we aren't anti-supplement. We're certainly food first, but we want to make sure that the supplements that you're taking are effective, they're safe, and they really are going to support the goals that you have. So we can review any supplements you're currently taking, talk about what they may be helping with or not, and then certainly recommend other supplements if needed, certainly where appropriate. Our visits are typically about 30 minutes. And as I mentioned, we offer that text communication between visits. We find this is really helpful for that supportive accountability, checking in to see, all right, how are things going with the recipes that I sent you to try? And how are you doing with your resistance training workouts? Were you able to get to in this week? And then also figuring out the reality is sometimes we have the best laid plans and they don't work. And that's fine. But we're here to help you figure out, okay, rather than throwing it all to the wind, how about we figure out a plan B so that you can still stay on track? Like I mentioned, we're in close collaboration with our physicians. So if something comes up on one of our appointments or through text communication where we think we might need some physician insight, we can reach out to our physicians and let you know, hey, this is what your physician communicated. Here's what next steps should be. Or we would recommend an appointment where appropriate, but we can help with that, navigating that. And like I mentioned, we are using behavior change coaching strategies that are not only evidence-based, but they really do work. I'm someone too that I know how these things work. I've been trained in it, and I still seek out coaching and support from professionals that can do this because it's so powerful.
Stacey, we have a question in the chat that I'm going to
So
bring to you. So,
perfect.
um, let me scroll up to it. So, would love to understand more about forced menopause due to a
Mm.
radical hysterectomy. Are things different in this instance for a person?
They can be. The main thing is that in those scenarios, it is more of a dramatic shift that one day you may be premenopausal or perimenopausal, and the next day you're postmenopausal. And so that is a big shift for the body and for the hormones, that we do see a more dramatic drop in those hormones. And so that does sometimes require a little bit different approach, and definitely something you'd want our medical team of physicians to be supporting with, as well as lifestyle components. But it can, rather than the progressive change that we see with a natural perimenopausal shift.
Great. A couple other questions.
Sure.
Do you support existing low carb eating styles and eating windows only between 11 and 7? I know we get this a lot.
This is a great question. We do get this a lot. So one of the things I want to make very clear is that the best nutrition plan is the one that you can stick with. And I always tell patients, can you do this for the rest of your life? Because that's really what we see the greatest success with. And so there's not one nutrition plan that's going to work for one individual. But what we will do, will evaluate your current eating plan, and also evaluate where your pain points or concerns are. And what we can bring to that is a lens around maybe some suggestions to improve if there are areas of concern that you want improvement on. Now, if someone says, I feel the best I've ever felt on a low carb plan and eating between 11 and 7, we're not going to mess with it if it's working. However, if we do hear often, what I hear in some of these plans, individuals struggling with nighttime eating, sometimes pushing that breakfast later actually results in feeling the munchies, or feeling, people will say, I'm really snacky at night, and it becomes hard to minimize eating at that time. So they end up eating the majority of their calories in the evening. So then we might talk about shifting. What happens if you shift it a little bit earlier? Talk about combinations of nutrients to see if that can help. And so it really becomes an individual approach. But like I said, we work with you where you are, and we're not going to ask you to change anything that you feel is working best for you. We trust that you know is best for your body, and we're going to provide you some insight, bringing the menopause lens to that, so you can really optimize and continue to build on what is already working for you.
And then I'll do one last question before we go to the next slide. Does HRT raise blood sugar? And I know we have
Oh
a whole session on blood sugar and
yeah.
menopause on our LinkedIn page, but would love
Hmm.
to know the answer to this question.
So that typically what we see in the research is that hormone therapy can help to better improve metabolic responses, including cardiovascular health and blood sugar control. So long term, it actually should be supportive. Now, that being said, it doesn't mean that an individual may not experience some changes in their own blood sugar in response. So, you want to make sure that, so I think that's something that's valuable. One thing that we our dietitian and even our physician teams always talk about is getting regular labs. And one of the labs that I think that should be done at least on a yearly basis, if not more often, is a hemoglobin A1C. So if you start a hormone therapy protocol and you have a baseline hemoglobin A1C and you check that within 6 months, that should give you an idea of, is your body increasing your blood sugar response to that treatment, or is it improving? So it can go more commonly, we see the improvement in those metrics versus the opposite. However, it's certainly possible that there's individual scenarios outside of that.
Right, I'll move us forward.
All right. So here we want to be thinking about those long-term measures of health, and these are areas where sometimes it's in the distant future, so we may not be thinking about it. But so many of these really are key. The prevention is key in the habits that we lie in the years ahead, and it comes back to that consistency. What can you do for the rest of your life? That's what is going to have the greatest impact. It doesn't have to be perfect. We want consistency over perfection, but we want to be looking at what is the long-term impact of that, of course, so that we can be thriving for the rest of our lives. So certainly weight management is one of those components that a lot of these habits can help with. Metabolic syndrome, prediabetes, and diabetes. We do see individuals during this change, times of changes in our bodies are vulnerable times. If you have a history of disordered eating or eating disorder, this can start to come back. Or for some individuals, it's triggered at this time. And so we want to be aware of that as well. Hyperlipidemia, so that elevated cholesterol, that relates to our cardiovascular disease. Estrogen is protective of cardiovascular disease and helping to maintain a lower cholesterol, specifically that LDL. So as that estrogen goes down, I think about it as we don't have that lever. That lever isn't as effective anymore. So we got to pull on other levers with our lifestyle to make sure that we're balancing that, or in some cases, hormone therapy as well. Bone health is a big one, where we really want to make sure that we're optimizing that through nutrition and exercise. And in this case, too, hormone therapy may also be helpful. We see shifts in digestion during the peri and postmenopausal transition. So sometimes that takes some different nutrition strategies to help manage that. We want to make sure that you are optimally fueling your exercise. We want to make sure you're getting the nutrients to do that and recover from it so you can get the most out of it. Some individuals now, anemia, so low iron, is not always common, especially if you are decreasing your menstrual cycles. And then obviously at menopause, you're no longer having that monthly or regular bleed. But for some individuals, especially if you have really heavy periods, which can be common during that perimenopausal phase, or more frequent bleeding, you may end up experiencing anemia, which can be addressed with nutrition and proper supplementation. Oncology nutrition, sometimes an area we do see patients that are breast cancer survivors who may also have been pushed into peri and postmenopause through their treatment plan, and we want to make sure that we're not only are we addressing those symptoms, but that we're also considering their oncology needs as well. And one of our dietitians is a certified oncology specialist in nutrition. All of these things, we want you to have improved quality of life. We want you to feel that when you approach your day, whether it's your work day, your time with your family, time with your friends, that you're able to embrace it in a way that really is of a high level of quality.
All right, thank you so much, Stacy. I hope that you guys all learned as much as I have from Stacy. And we have a couple of places where you can go to just learn more. So on genev.com, we have hundreds of free educational resources to answer all the questions that you have. But we highly recommend that you set up an account with Genev and take our free menopause assessment and set up an appointment with a doctor, right? Because there's tons of questions in the chat about your specific situation. And so we want to make sure that we invite you to set up your account and set up an appointment with a Genev doctor. We have availability for appointments throughout the entire month of December. So if you book now, we can work together to help start your 2024 off Right. I highly recommend that you just check in with your insurance to see if it's covered. I will say we are covered and in network with Aetna and United Healthcare. So if you do have those insurance, you already have access to Genev. You can go ahead and book an appointment. Just enter in all of your insurance information, and it will run through insurance. So highly recommend that we get started there. We do have we do have a little bit of time for other questions if you want to stay on, because there's a few questions in here that we didn't get to, but I wanted to just make sure that we close out today. For those who do have to jump, just really appreciate your time, and I'm going to just drop in a poll just to check to make sure that we kind of met our goal of increasing your knowledge about menopause. It's really important to us. We know that there is a lack of menopause awareness out there, and we want to make sure that we close that gap for you.
And as
So
you're
thanks
completing,
everyone for joining. Really appreciate it. And Stacy, if you have a few extra minutes, we can talk through a few of those questions, those lingering questions in the chat.
absolutely. And as you're gathering those and you're completing the survey, one other thing I will mention, a theme that we hear from a lot of our patients is that they come to us when they have waited long enough. And what I would love to see is more patients coming to us to say, hey, I noticed something changing in my body and I want to figure out how to circumvent this and stay on top of it. And I know this is a busy time of year with the holidays coming up. It's already a challenging time of year for a lot of people. You don't need to make it harder. So check out, if you've already filled your insurance deductible, this could be a great time to schedule an appointment with one of our doctors, get scheduled with an RDN for the new year. Really just take advantage of this time. It's 30 minutes of your time that can really save you. It's an investment in your health that can save you time in the long run.
Awesome. Let's go through a couple of these kind of lingering questions. Um, if you start HRT, are you on it for life?
That again depends on you as the individual. The Menopause Society, which is one of the overarching governing bodies of menopause, if you will, it's both academic and clinical. And they recently, actually now almost a year and a half ago, released a position statement, which is accessible to anyone. So if you Googled Menopause Society position statement on hormone therapy, that says that it's an individual decision and you don't necessarily have to go off of it if it is still providing you benefit. So it really comes down to you as the individual. I know anecdotally, I could share, I have some patients that get on hormone therapy and they are like, oh my God, never take this away from me, please. And so with their physician, they have that conversation. They go over risk to benefits and what that is for them. Some others want to use it just to get through that transition that's really difficult. And then they want to come off of it and see how their body is responding. So that
Oh my
does
God.
becomes a decision between you and your doctor. But you don't have to stay on it for the rest of your life, but some people choose to based off of how their bodies are responding.
Great. Another question that has come up is, do perimenopause symptoms vary during the week of your period and before it?
It certainly can, because those are both times of hormone fluctuation. So just like you may have had differences during the premenopausal phase, which may have been PMS symptoms, most commonly known as, that can also be reflective in this stage. So any time of hormonal shifts, those symptoms can vary. It can vary cycle to cycle. We do see more variation, sometimes more frequency of these symptoms during that perimenopausal phase specifically.
Great. Do you consider being in perimenopause based on blood work or symptoms? I love this
Great
question.
question. We often get, don't you have to do labs, see where my hormones are to be able to treat? So the evidence-based recommendations for treatment is based on symptoms, not labs. The reason being, as we are talking, the extreme variation in hormones right now are the clinical metrics of hormones are just going to take that snapshot in time. So when you go into that lab, they draw your blood, the results are looking at that hormone, the hormone state right there. So right now, we aren't able to treat based off of that number because that number could be changing as soon as you're walking out the door of the lab. So what the recommended approach is to really assess your symptoms and treat based off of the symptoms. Now, that being said, there are some scenarios where labs may be necessary, so it's not an all or nothing, but that's an individual case with the doctor, and certainly our physicians would go over that with you. But generally speaking, when it comes to treating the symptoms, we really want to make sure that we're treating those symptoms, not just the number. So we're treating you, the individual, and your quality of life, not just a number. Sometimes that number may fall within a normal range, and you're saying, I'm having incredible night sweats, brain fog, difficulty concentrating, and mood swings. Well, we don't want to say, oh, well, it's normal. We're not going to do anything. We want to make sure that we're treating those symptoms in that way. On the same time, you may perhaps have an abnormal lab, but you may actually feel fine. So we also don't want to treat in those situations. It really comes down to the individual.
Great. And then there's one more question. I think this is a little bit of myth debunking, but does menopause happen earlier if you don't have children?
That's a great question. At this point, we do not have data to support that. The closest predictor of your menopause age and experience would be your biological mother. That's what we see in terms of genetic links. And even that, as you can imagine, probably isn't an exact science. I do know certainly with the patients that I work with right now, a lot there that their generation of mothers, actually, a lot of them had hysterectomies. That was a period of time where medical recommendation was if you're done having children, we just have to remove this uterus. We don't need it anymore. So a lot of women, so you wouldn't have an accurate assessment there, but your biological mother would be the closest predictor, not age of menarche and not number of pregnancies throughout your life.
Great. I also really love this question. I think this one's really important based on kind of a lot of what we're seeing in the media and the things that are being advertised to us. What is Genev's stance on compounded HRT and pellets?
Great question. And I think we do have information on our website on that. So we do not prescribe any compounded hormones or pellets. Reason being, these are not regulated. So what is in them can vary, and there have been, especially with the pellets, there have been cases. You can look this up even on that the FDA has gone after certain companies that have. Inserted pellets into patients that have a much higher level of testosterone than was thought to be in there or was put on the package, and there's significant consequences to that. Women do have testosterone in our bodies, and this is a hormone that decreases with aging. However, the supplementation of it is only required in really specific situations, and really that is a scenario that requires in-person care. So at Genev, we use all FDA approved hormone therapy. That does include, in some situations, bioidentical FDA approved hormone therapy. So that sometimes people think you can only get bioidentical and compounded. There are FDA approved versions. So that's certainly something that we can provide. But we want you to have a safe hormone therapy experience. And when it comes to the compounded versions, there's just the lack of regulation increases the risk to you as the patient, and we don't want to put that on you.
Great. And then, so there's a specific question about an IUD, but I think this is in general about birth control. Does birth control mess with these changing hormones?
Mhm. So this good question. So what you want to be thinking about, and I just had one of the great things about the collaboration with our physician team is that our dietitian team has this great knowledge base, right, to learn from them all the time. And we had one of our physicians, Dr. Lisa Savage, come to our team meeting last week to give us the past, present, and future of oral contraceptives. Because even in my lifetime, I've seen a transition with these, and there's a lot on the market. And one of the things that our physicians are really great at is dialing in the oral contraceptive that's best for the individual at that time. Sometimes, especially if someone is still cycling regularly, menopause hormone therapy is not going to be effective. Not always. And it is something that our doctors can talk to you about trying. But in some cases, actually, an oral contraceptive, and there's some that are designed for that perimenopausal phase, may be a more effective option for you. So, to answer your question, can these mess with the hormones? Sometimes they can mess with the hormones in a good way, providing a stabilization and a minimizing of symptoms. Some scenarios, it does sometimes take a little bit of trial and error, they aren't as supportive, and it's important to find the right one. Our doctors, giving their experience, are able to help you fine tune that hopefully sooner, and then also be able to help you know based off of their clinical experience and training what would be most effective. So, in some individuals, the approach that they're using or an oral contraceptive that they used in premenopause may no longer be appropriate with these changes. And in some scenarios, a oral contraceptive designed to address the symptoms they're experiencing and those hormonal changes can be just what they need.
Great. I think that covers all of the questions in the chat. Unless anybody has, I'll give it kind of 10, 15 more seconds for anybody to drop in any additional questions. We just really appreciate you guys taking the time. This is such an important topic, and we know that there's just such a lack of information about menopause. I know I learned something from Stacy today. I always learn something when we do these sessions, so I'm really grateful. We'll continue to offer these types of sessions for you to attend. We just really appreciate it, and we really hope to see you and hope that we can support you in your menopause journey. Thanks, everyone. Have a good
Thank you.
rest of your day.